Alright guys, just a reminder, this is not official medical advice or such. Please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with another episode of the Common Sense MD. And today I want to talk about something that you may or may not have heard of. It's called MCAS, Mast Cell Activation Syndrome. It's really interesting, very common, very under-recognized, but we need to talk about it a little bit because it may apply to you or people that you know that have these kind of symptoms. But here in East Tennessee, we all know about allergies. You know, they're bad around here, especially in the spring and fall with hay fever and pollen and all that. But what about a condition that causes repeated episodes of allergic reactions? Symptoms that can affect multiple body systems. It's called MCAS. Like I say, Mast Cell Activation Syndrome, which occurs when mast cells, which are a type of blood cell that's part of your immune system that releases mediators, like mainly histamine, in response to triggers that usually aren't harmful, like certain foods or environmental chemicals. We're not talking about reactions to pollens, which you get histamine release, but these are to other types of environmental toxins. And as you know, we live in a very toxic environment. So we're seeing a ton of this. And we'll talk about maybe why in a minute. But in any event, so symptoms can include hives, swelling, low blood pressure, shortness of breath, diarrhea, rapid heart rate, headaches, including migraines. Mast cells are really a first line of defense of your immune system. But here we're talking about abnormally large amounts of release of these mediators that overdo it. It's just too much. And it can really make for recurrent, terribly bad irritations. You probably know people like this. You just don't know what the heck's going on with them. Most doctors can't figure it out because it's hard to figure out. There's not a simple blood test that'll tell you they have MCAS. But it's common in today's toxic environment. You know, we're seeing this a lot. It's been estimated that up to 20% of our population really has this, and a lot more now because of COVID, which we'll talk about in a minute. But in any event, most of the time it's not recognized, and most of these people suffer for, a long time and never really figure it out. But in fact, you know, we're seeing all this long COVID. Probably 1 out of 4 people that had COVID develop some form of long COVID, which means that you have symptoms after 3 months of getting over a COVID infection. You remember that. So COVID and MCAS are very interrelated. Remember that cytokine storm that we were all talking about on the news with COVID-19? Well, mast cells are one of the main producers of inflammatory cytokines due to the abundance of angiotensin receptor converting enzymes. Remember these that we talked about, how that virus got in on the ACE2 receptors in your cells, and that's how it got in? Well, that's kind of why mast cells play a big part in this. They're responsible for a lot of this. It's an overactivation. So you remember that pathway. In addition to, these mast cells simulate other releases, other inflammatory cytokines, like platelet activating factors, of course histamine, but heparin, tryptase, prostaglandins, leukotrienes, and chemokines like interleukin-6 that you hear a lot about. That's really scary stuff. It's a hyperimmune response that you don't want. The locations of mast cells, you find them a lot in the pulmonary perivascular space. That's why it really got into people's lungs, and that's what COVID did to lungs because of this. You know, it turns out that the mast cells mature in your lungs, in the pulmonary vasculature. They're more abundant in the gut cells, which we'll talk about in a minute. But so that's one thing that happened with COVID and caused so many problems with pneumonia and deaths was it activated those mast cells in your lungs. And, it was just terrible. A recent study, which is an observational study, shows that patients with long COVID have virtually identical mast cell symptoms as MCAS patients. Symptoms like fatigue, brain fog, because it passes the blood-brain barrier. Tachycardia, remember POTS syndrome that we're seeing a lot of that. Insomnia, shortness of breath, migraines, paresthesias, arthralgias, hives when exercising. If you have that, you probably have MCAS. Abdominal pain, flushing. These people don't do well with alcohol that have MCAS. But like I said, MCAS is really very hard to detect because there is no real increase in these mast cell numbers. What's increased is how they're activated, the activation of these inflammatory cytokines that we talk about. So it's rarely recognized, but it very frequently occurs. I'm sure you all know people who have this. Doctors certainly have patients that come in their office a lot with this, and they really, a lot of times, just miss it because it's hard to detect, and there's so many different symptoms. But if they go back and kind of look at things, it very well could be MCAS. And there's a lot of overlap with other diseases like Lyme disease. I mean, which doctor likes to see Lyme disease walking into their office? Well, in fact, it may not be the Lyme disease in itself. It may be the MCAS that's really causing all the symptoms from your Lyme disease. So it's very related to Lyme disease, and probably mold exposure as well could trigger this MCAS. Mercury exposure as well. It can cause something that I see in my office sometimes called multiple chemical sensitivity syndrome. These people react to everything. Perfume. They come in your office and they break out in hives because somebody walked by with perfumes. That's an MCAS patient. It's thought really it could be related to this syndrome we're seeing called Ehlers-Danlos syndrome, which is a connective tissue disorder where you get real lax tendons and ligaments. You get hurt all the time. Now, there's a genetic tendency to this, and you may have a SNP for that, but we're certainly seeing a lot of it, and it may be something that we need to talk about in a future podcast. Is Ehlers-Danlos syndrome, because we're seeing a lot of it. So if you think a patient has this, how do you treat it? It can be very complex. So it's usually going to fall in the hands of a functional medicine doctor, maybe an allergist sometimes. But remember, most mast cells originate in the gut. So with functional medicine, we always start with the gut, and we start with detox. Clean up the diets, cut out glutens and dairy, of course. Use L-glutamine. It's one of my favorites for this. Use pro-resolving mediators like EPA and DHA. Vitamin D, very important treatment of this. Remember how essential this was for COVID? I mean, high doses of vitamin D, just very essential for COVID patients, especially early on. I mean, I think almost everybody should be on a vitamin D supplement, as you know, D with K. Magnesium is good for MCAS. Estrogen is very important for it. Hyperbaric oxygen for severe patients is very helpful. It stabilizes mast cells. You can also use H1 and H2 blockers. Of course, like Benadryl is an H1 blocker, or Claritin, Zyrtec. H2 blockers like Pepcid. That can be very helpful. I don't like you to use prolonged PPIs, but for a lot of patients, I think an H2 blocker like Pepcid, even on a daily basis, can really help them if they have severe symptoms and they have MCAS. Aspirin helps. I've been a big believer in aspirin for many, many years for many different reasons, but it helps this syndrome. Singulair, the medicine we use for asthma and allergies, it blocks those prostaglandins. It blocks the leukotrienes. The aspirin blocks the prostaglandins. I like quercetin. That's a great one in MCAS. But avoid the triggers if you can. If you can kind of figure out which foods that you're very sensitive to, or situations that you get out in the environment and are very sensitive to. If you can avoid these, but always start with the gut. You need to get on some of these natural and maybe some other medicines. A lot of them are over the counter though, so they're very safe. But remember, MCAS, people suffer from this disorder for decades, and docs really never figure it out. These patients are miserable. So do your reading and research about MCAS and see a functional medicine physician and get to the bottom of this, because there is help. I hope this educates you a lot on this syndrome. I'll see you next week.